Good day, Kalaga. I'm Leia, your future nurse. I am here to show you the assessment of the ears, nose, and throat. I'm just going to introduce the areas of the assessment. First is the ear. It is the organ of hearing and equilibrium in vertebrates. In humans, consisting of an external ear that gathers sound vibrations, while the middle ear, in which the vibrations resonates the tympanic membrane, and a fluid-filled inner ear that maintains balance and that conducts tympanic vibrations to the auditory nerve, which transmit them as impulses to the brain. While nose is the body's primary organ of smell and also functions as part of the body's respiratory system. Regarding to the throat, it is a passage from mouth to the stomach or to the lungs, including the pharynx, esophagus, larynx, and trachea. The equipment we need in conducting this assessment is a pen light. It is used to visualize the eyes, pupillary, ears, nose, mouth, and throat for inspection. And the tuning fork, it is a metal device that produces harmonic vibrations when the two prongs are struck. It is used to test the hearing and bone conduction. And the tongue depressor, it is a tool used in medical practice that depress the tongue to allow for examination of the mouth and throat. Through these assessments, the nurse can identify the small differences between life-threatening conditions and benign ones. Again, the procedures prior to the assessment was presumably done. This is the continuation of the eye assessment. Now, let's start to obtain the health history of the patient's ears, nose, and throat. Sir, I will now assess your ears, nose, mouth, and throat. But before that, I will ask again some couple of questions. Is it okay, sir?
It's fine.
Okay. Sir, do you have any problems with your mouth, ears, nose, or throat? Like having a frequency of sore throat, difficulty of breathing in nose, or the experience of some hearing loss?
I do not have any of those.
Oh, okay, sir. Now I will begin to assess first your ears, then second is the nose, and then next is the mouth and throat. First, position the client in a comfortable one. Inspect the external ear, palpate the auricle, and push on the tragus. Then, palpate also the mastoid process lying directly behind the ear. Okay, sir, I will now inspect your external ear. Your ears is symmetrical in shape. It is proportional to each other. The pinna is in line to the inner contus. Your ear skin have fair complexion. I do not see any lesions. And the integrity is intact. Sir, I'm going to palpate your auricle. Tell me if you feel pain. Here, sir?
No.
Here?
No.
What about this part?
No. No.
Okay. There's no presence of pain. Now I am going to push your tragus. Again, tell me if you feel pain. Here, sir?
No.
Here?
No.
Here?
No.
There's also no presence of pain and lesions. Now I'm going to palpate your mastoid process. Here, sir? Here?
No.
Oh, okay. Now, I don't see any abnormalities upon palpation and inspection. Take note if there's pain upon palpation on the auricle and tragus, it indicates that there might be an inflammation on the external ear or probably a lesion inside. You notice during the inspection in the mastoid process that there's an inflammation, you do not need to palpate it directly or in deep pressure because definitely there is pain. Remember, if there's any inflammation in the muscle part of the mastoid process, it is called mastoiditis. It means an inflammation particular in the middle ear. Additional information in inspection of the auditory canal. You need to use the otoscope. It is an instrument with lightning and magnifying systems for visual examination of the tympanic membrane and auditory canal. When inspecting an adult, pull the upward of the ear then downward. The lining nucleus of membrane should be pinkish in color, negative for lesions and positive for cilia. If there's any secretions, note it. Check the amount and the color of the secretions. Inspect if there's also an earwax inside, and the tympanic membrane should be shiny, grayish in color, and translucent. Now, perform the whisper test. Position the patient. Your mouth should be 1 to 2 feet away from the patient's ear. Ask the client to close the other, then whisper a word, and ask the client to repeat it. Do the procedure on the opposite ear. Okay, sir, we are going to perform the whisper test. I need you to close one of your ear, just like this. I'm going to whisper words, then repeat it. Okay?
You did great.
Okay, now on the other side of the ear.
One word.
Oh, okay, now good. Your ears are able to hear my whisper. You have a normal hearing ability in your right and left ears. Using whisper test. Take note, if the client cannot hear the whisper, there might be some abnormalities in the ears. Let's proceed in performing the tuning fork. To evaluate the auditory acuity, air conditions, and bone conditions. Using the Rhine test, Weber test, and the Romberg test. 1, 2, 3, go. Take note if the client cannot hear the whisper, there might be some abnormalities. Let's proceed in using the tuning fork to evaluate the auditory acuity, air conductions, and bone conduction. Using the Rhine test, Weber test, and Romberg test. Sir, I will use a tuning fork to check your air conductions and bone conductions in testing your hearing ability. Tell me if the sound stopped. Are you ready, sir?
Yes.
We will do the Rhine test. Now for air conductions.
It stopped.
Okay, 11 seconds. Now to the other one.
It stopped.
Okay, 11 seconds also. 11 seconds on both of your ears upon using the tuning fork to check the air conductions. Sir, now let's proceed to the bone conductions. I will place the tuning fork behind your ear. I will just lightly point this, then tell me if it stopped, just like the earlier procedure. Are you ready, sir?
Yes.
Okay.
It stopped.
Okay, 16 seconds. Now on the other side, sir. Now on the other side, sir.
It stopped.
Okay. 16 seconds for bone conduction upon using the tuning fork. Sir, we will now perform the Weber test. It is the combination of checking the air conduction and bone conductions upon using this tuning fork. I will place the tuning fork in your head. Tell me if you hear it synchronously on your both ear. Then, tell me again if it stopped. But also tell me if either your right ear or left ear cannot hear it. Alright? Okay.
It stopped.
Okay.
And by both of my ears heard it equally.
Okay, sounds heard for both ears synchronously for 21 seconds. Now, sir, we will do the Romberg test just to check your body's equilibrium. Can you stand, sir? Okay, place both of your hands on the side of the body. Now, Now, close your eyes for 20 seconds. Now, close your eyes. Okay, sir, open your eyes now. Okay, you can now see. There is a visible swaying upon standing. Note that the abnormality in the Rhine test and Weber test, when the patient's one ear cannot hear it, but the other one can. While on the Romberg test, if the swaying is very visible, it may indicate that there's a problem in the vestibular process. However, if you see a little bit swaying, it is normal. Now let's move forward in assessing the nose and sinuses. Instruct the client on what are you going to perform. Inspect the nose for symmetry, shape, size, skin lesions, and sign of infection. Then test the nose for its patency. Okay, sir, now I will inspect your nose. It is centrally located. The nostril is symmetrical to each other. Your nose is proportioned to your face. It has fair skin complexion. There is no presence of lesions and negative for infection. Now, sir, we are going to do the patency test to your nose. Please close your nostril, just like this. Close your nostril. Then inhale. Can you inhale easily?
Yes.
Now, on the other side, same procedure. Inhale. Can you inhale easily?
Yes.
Now, your patency is normal. If you notice that there's a secretion in the patient's nose, it may indicate that there's a sign of infection. And if the patient cannot inhale or exhale easily, most probably there is an obstruction or swelling from the inside or trauma. Regarding to the use of nasal speculum, it is a metal device that resembles either pliers or scissors. To assess it, ask the patient to lightly hyperextension his or her head. Then use the speculum, place it to the nostrils of the patient, enlarging it. Then use a pen light. Check the mucous membrane, it should be pinkish. Check if there's a secretion or lesions inside. Then check the cilia. Inspect also if there's a discharge or foreign bodies. That's how you're going to use the nasal speculum. Let's proceed in palpating the external nose for tenderness, swelling, and stability. Palpate and percuss the sinuses. After that, transluminate the sinuses. Reminder that we have frontal and maxillary sinuses in palpation and percussion. I am going to palpate your external nose. Tell me if there's any pain, okay?
No. No. No.
Negative for swelling. Nose is intact. Stability upon palpation. Now, sir, I am going to palpate your frontal and maxillary sinuses. Tell me if there's pain, okay?
No.
I am going to percuss it, okay? Tell me if there's any pain.
No.
Here,
No.
here, the maxillary sinuses. Okay. Negative for pain upon palpation and percussion. Okay, sir, I am going to transluminate your sinuses by the use of pen light. So, okay. It's a pinkish in color. Now for the maxillary sinuses. there's pain upon the palpation and percussion of the frontal and maxillary, it indicates of having a positive sinuses or allergies. If you also notice that there's a cloudy or grayish in color upon transluminating the frontal and maxillary, it indicates of having a mucus. Let's move forward in assessing the mouth and throat. Inspect and palpate the lips, inspect the teeth, and inspect and palpate the buccal mucosa, gums, and tongue. In assessing this part, we need to use gloves for infection control. It is also for the client to not be uncomfortable during the procedure in this part. Okay, sir, I am going to inspect and palpate your lips. Okay. Your lips, it's moist and pinkish in color, symmetrical in shape, and it is proportioned to your face. Negative for any lesions or swelling on palpation and inspection. Now, sir, I am going to inspect your teeth. Please show me your teeth. Okay. Open your mouth, sir. Okay. Up, sir. Teeth is yellowish and it is positive for dental caries. Open your mouth again, sir. You have 21 teeth. It is a mixture of temporary teeth and growing permanent. Okay, sir, open your mouth. I will inspect your tongue. Your buccal mucosa is shiny and pinkish in color. Your gums is also pinkish. There's no signs of lesion. And your tongue can move freely. Okay, close your mouth, sir. Relax. Can you move your tongue upward? Okay, your Wharton's duct is intact. And also your Stenson's duct is also intact. Now close your mouth, relax. We'll use the tongue pressure to check your throat. Open your mouth. Your tongue. Okay. Your uvula is centrally located. It's moist and pinkish in color. It is negative for any lesion. Close your mouth. Relax. Now open your mouth. Your tongue. Okay. Your tonsils is symmetrical and it's a pinkish in color. There's negative for any lesions and it's moist. Okay, sir, there's no presence of abnormalities upon inspection and palpation. If there's a presence of lesions in the patient's mouth or lips, throat, may indicate in having fever, blister, or cold sore. And in the adult teeth, it is certain to. If the patient is slightly tired in opening the mouth, you can ask them to close it again and relax, then open it again. Take note if there's a pain inside salivary glands, it may indicate that there is an obstruction or inflammation or infection. If the throat is whitish in color, it indicates of having infection or inflamed. I hope I clearly showed to you the assessment of the ears, nose, mouth, and throat. Once again, Kalaga, your future nurse, Love, Leah. See you and thanks for watching. Bye!